Good day, fellow learners. Once again, this is your mentor, your fact check buddy Ray Gapuz, joining you for another teaching and learning session. And this time, we're going to talk about some pointers related to the next generation NCLEX RN. And this is already pointer set 4. If you may want to watch my old videos, they are still very relevant to the next generation NCLEX. Kindly check out the videos related to quick fix. So this time, let's move on to our next generation NCLEX pointers set 4. Okay, so before anything, I'd like to congratulate Miss Pamela Rose Paras, who is now a registered nurse in the Australia Board of Nursing. By the way, for those who don't know, Australia has also adopted the NCLEX as their licensure exam. So let's move on and let's try to figure out what are the things that I'd like to highlight for today's session. So before that, join our hundreds and thousands of nurses around the world who already have passed the NCLEX to our system. So text or call 0906-201-9383 or send us an email at info@ragapusreview.com. So let's begin with our NGN pointers. And definitely you would want to find out what are the trends now. If you need to browse your notes, you may want to pay particular attention to these things that I'm going to share with you. Okay, so to answer the question, what are the things that we need to study? Let's begin from an expert's point of view. So remember West Nile virus, okay? So your West Nile virus is the one that causes your West Nile fever that could potentially develop into West Nile encephalitis or meningitis, which simply means this type of virus can cause inflammation of the meninges and the brain. But the good thing is, since this is a viral infection, it can be just treated with supportive measures like administration of medications that are necessary to relieve the symptoms, as well as to manage the fever of the patient. So sometimes it could even go away even without the need for treatment. Now, the most important things that you need to remember about West Nile virus would be, number one, how is it transmitted? Primarily, it's transmitted through the bite of Culex mosquitoes. So it's very important that if the patient is coming in with signs and symptoms of viral meningitis like phonophobia or photophobia with stiffness of the neck or neck rigidity, so assess if the patient has been bitten by an insect or by a mosquito. So what is important is, apart from the bite of a mosquito, you also have to pay particular attention to the other means by which the virus could be transmitted to the patient. One could be through exposure in a laboratory setting, or when there is blood transfusion, or when there's organ transplant. For those of you who are wondering whether this could be transmitted by the mother to the baby in utero, there have been cases that points to that mode of transmission. And some cases even points to the fact that this could be transmitted through breastfeeding to the baby. Okay. Now, however, it's also important to note that your West Nile virus is not spread by eating raw fish or animals. Even holding animals would not make you have the virus. It is not transmitted by sneezing or through coughing or by touching live animals. No. So let's summarize once again. West Nile virus is not spread through eating raw fish or animals, coughing, sneezing, or even touching animals. It can, however, be spread by, once again, it can potentially be spread by exposure in a laboratory setting, blood transfusion, organ transplant, transmission from the mother to the baby in utero, and of course, breastfeeding. Now, if you talk about prevention of West Nile virus exposure, it's very important to highlight two things. One, they have to apply your diethyl entoluamide or DEET lotion. Okay, that's an insect repellent. And second would be, we need to instruct clients that if they need to go out towards areas that are considered as breeding grounds of mosquitoes, they can potentially prevent mosquito bites by wearing clothing that covers the arms as well as the legs. So long sleeves clothing and long pants would be a welcome preventive measure for your West Nile virus infection. Now, in most cases, your Wells Nile virus infection is asymptomatic, and some patients would just have fever. How would the doctor verify or validate that there's indeed West Nile virus infection? It's through a laboratory test that requires either blood specimen or spinal fluid specimen. Now, for those who are asking in their minds if there's a vaccine, there's no available vaccine currently. And usually the treatment is symptomatic, which means we treat the symptoms as it presents. So if there is fever, so we administer medication for the fever. And then we promote rest, and definitely we need to increase fluids for the patient such that we would be able to manage the temperature properly. Okay, so once again, West Nile virus, let's summarize. It is primarily transmitted by the bite of Culex mosquitoes. Take note, but there are cases in which other means of exposure that would include, okay, your exposure in a laboratory setting, blood transfusion, organ donation, mother to the baby, and of course, it could also be transmitted through breastfeeding. However, it is not transmitted by eating raw fish or coughing, sneezing, and even holding animals. Okay? No vaccine currently, and it's important that you provide rest, and preventive measures include application of your diethyl entoluamide DEET lotion, and of course, wearing appropriate clothing, which means long sleeves and long pants. Okay? So the next important thing that I'd like to highlight is actually the drug nicardipine or cardine. Now, nicardipine is a calcium channel blocker, so it is given to patients with hypertension and chest pain. So it has the potential to definitely affect the blood pressure. So you have to monitor the blood pressure and the pulse rate. Now, your nicardipine can be given to patients with increased heart rate because it helps to lower down the heart rate. Now, pay particular attention to three common side effects. Remember your NFS. Okay, three letters, NFS. N would be your nausea, F would be your fast heartbeat and flushing. Okay, then S would be swelling of the feet and the lower legs. And the most important thing that you have to remember, some calcium channel blockers, including your um, nicardipine or cardine, would definitely be affected by intake of grapefruit products or grapefruit juice. So the grapefruit juice will delay the excretion of the drug, and it could potentially increase the serum levels. Now, other drugs that could be affected by your grapefruit juice includes your, remember, your CVVD. So you have your cyclosporine, your verapamil, Valium, and diltiazem. Together with nicardipine, once again, these drugs will be affected by your grapefruit products or grapefruit juice. Okay? Next important thing would be cohorting. Now, when we say cohorting, this is grouping patients um, in one room, placing them together in one room, making sure that they will not worsen each other's condition. Therefore, it's not appropriate to cohort a patient who is immunocompromised, for example, a patient undergoing chemotherapy or under steroid treatment, with someone who is a source of infection, like, for example, a patient with pharyngitis. Okay. However, two patients who are infected with similar microorganisms could actually be placed in one room. So the best roommate for a patient with tuberculosis will be another patient with tuberculosis. Now, on the test, what about if you are given, for example, an immunocompromised client, a client with full-blown AIDS with pharyngitis, who is the best roommate? Definitely, you will have to eliminate patients with whose diagnosis could be unknown origin, because these patients are primarily treated as infectious. So if a patient has diarrhea of unknown origin or fever of unknown origin, that client is not an appropriate roommate for the client with AIDS and pharyngitis. So if you're going to narrow down your choices, think about what's the primary isolation precaution for the AIDS patient. The patient is usually placed under standard precautions simply because the AIDS virus, the AIDS causing virus rather, is not transmitted through casual contact. Therefore, we can place the patient in the same room with a patient who could be placed under the same type of isolation precautions. For example, hepatitis B or hepatitis D, these patients are placed under standard precautions. And hepatitis B and hepatitis D, as we all know, is primarily transmitted through blood and body fluids. So, which simply means if a patient with AIDS and pharyngitis stays in a room with a patient with hepatitis B, then there's less chance of them. There's actually almost zero chance that they will worsen each other's condition. Now, the cohorting principle is not the same, however, if your patient has hepatitis A and hepatitis E, because this is what we call as your infectious hepatitis, in which the transmission could be fecal oral. So remember, the appropriate roommate for a patient with AIDS, with who is suffering from pharyngitis. Remember, the patient is immunocompromised. So therefore, therefore, the AIDS virus is not transmitted through casual contact. So you can place the patient in the same room together with the patient who can be placed under standard isolation precautions, like a patient with hepatitis B. So those are the things that I'd like you to remember for your test. Okay? So once again, how do you study? Let me share with you the strategies that Pam employed when she prepared for her NCLEX for Australia. And this is her self-prepared video, which we asked permission from her if it's okay to integrate it into this video greeting for her. Okay, so let's take a look at what she studied. So if you would notice, those are the printouts of the notes from the Ray Gapuz system. These printouts are usually given for free, and that's her studying. And if you would notice, she's using NCLEX 311, which is also a free book given through the Ray Gapuz system. That's the one good thing about our system. You get all the learning tools at no additional cost. And then she's also studying our drills that we provide. Once again, that's at no additional cost. And that's the favorite of almost all NCLEX passers, the pharmacology book, the fourth, they'll say NCLEX 311. And what is unique to the Ray Gapuz system? The use of functional concepts. Look at this lady. She printed all the handouts, and so she was saying to the staff and the little training because we give them a copy of all the topics that we are discussing online. So they can have the option to print it out or either to have the soft copy. And this is her reaction when she did the PVT trick. Okay, because it stays there almost there. Now let's pay particular attention to her reaction when she had her results, and it showed there that she made it. Okay, so once again, Pam, from the Ray Gapuz System family, congratulations, and we wish you well as you prepare for your next phase of career as a nurse in Australia. Okay, so this is also our core shell. It's the new product that we have, the Ray Gapuz core shells. These are the ones that they're using. You can use it anytime, anywhere. It is a combination of our Q-Bank, video strategies, short quizzes, long quizzes, name it. Next generation items, we have a lot. Okay, and we have covered all the 8 major subjects like safety and infection control, basic care and comfort, health promotion and maintenance, management of care, physiological adaptation. We have 3 videos for physiological adaptation, 1, 2, and 3. And of course, you have reduction of risk potential and psychosocial integrity. All of these for a very minimal fee of just $149. And you can initially access it for 2 months, but you can extend it until you take your test. You just have to inform us. So it seems like this is also a tool that you can use for an unlimited basis. Okay. So, and of course, the third, okay, important thing for you to remember is you have to be in a conducive environment. The environment should give you a sense of focus. Do away with learning tools that are standardized. It will not work for the next generation NCLEX. You have to know what to study and allow your experts from the Ray Gapuz system to direct you only to those topics that you need to focus on and the details that you need to remember. That's what we do for the last 30 years. So we're actually the oldest in terms of creating our system here in the Philippines. Proudly Filipino. So this is the NCLEX RN simulation room, and we have here our classes. So very conducive for those who are preparing for the NCLEX RN. And may I invite you to avail of the next generation NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Now, this program will allow you to choose live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, the QBank plus the 3 books, then next generation NCLEX strategies and sample questions, plus the most in-demand and most anticipated quick fix sessions that you will have exclusively with me as your mentor for 3 days. And of course, the 10 days boot camp, you can choose and opt to also attend the boot camp. So the fee starts at $3,499. Give us a call at 0906-201-9383. Once again, 0906-201-9383, and find out how we can best help you within the budget that you have. So give us an email if you would want to learn more, info@ragapuzreview.com. So this is once again your mentor, your fact check buddy, Ray Gapuz, saying thank you for joining us this week, and I'll see you back again for more tips and pointers on the next generation NCLEX. Good luck and God bless to those who are taking their test soon. Take care and have a good day.